Welcome to my presentation on teleradiology. My name is Molly Tate, and today we will explore how teleradiology revolutionizes the field of radiology and healthcare delivery. As we dive into teleradiology, it is important to understand its context within the broader field of telemedicine. Telemedicine encompasses various aspects where medical services are provided remotely through telecommunications technology. Some key components are real-time or synchronous telemedicine. This involves live interactions between healthcare providers and patients, such as video consults or telephone follow-ups. Store and forward, also known as asynchronous telemedicine, this allows for the transmission of data like images or labs for further and later evaluation. There's remote patient monitoring, often referred to by the acronym RPM, which involves the continuous monitoring of patients' health data from a distance, often utilized for chronic disease management. There's also mHealth, or formerly known as mobile health, which utilizes mobile devices to support medical and public health practices. Some of the specialized areas include telepsychiatry, teledermatology, teleophthalmology, telepathology, telecardiology, and teledentistry. But today we're going to focus on teleradiology, which involves the electronic transmission of radiological images for remote interpretation and consultation by radiologists. This practice is transforming how we deliver radiological services, especially within the context of access, efficiency, and patient quality of care. Over the last 20 years, radiology has experienced extraordinary advances and expansion due to digital radiology, the network of radiological processes, and the advent of teleradiology. Teleradiology has become extremely widely adopted. However, it does present numerous technological, professional, economic, organizational, and even ethical and legal challenges. But first, I want to focus on what teleradiology is. In essence, it is the electronic transmission of radiological images from one location to another, with the main purpose of interpreting or consulting a diagnosis. Sounds easy, right? Pretty simple, straightforward. Traditionally, the focus of teleradiology has been on diagnostic image reporting and the use of information and communication technologies. However, the role of the radiologist extends beyond merely generating reports or interpreting medical images. Radiologists are integral to solving problems for the referring clinicians by providing relevant diagnostic information, aiding in clinical decision-making, and ultimately reducing uncertainty. Teleradiology integrates technological, procedural, and professional elements to really benefit and serve the best interest of our patients. However, adherence to good practice guidelines is essential, and those guidelines must be explicated by each facility that utilizes teleradiology. These guidelines offer directives on various aspects of teleradiology, just like any other practice in how we conduct telemedicine, and are there to establish fundamental principles and set procedures based on ethical and legal norms that we set ourselves accountable for. They also define standards and indicators for quality and safety. The need for teleradiology arose from the demand for timely and accurate radiological services, especially in remote and underserved areas where access to radiology specialists is limited. This need has always been pervasive, but was exacerbated by the COVID-19 pandemic, which highlighted the importance of remote healthcare solutions. Essentially, the pandemic accelerated the adoption of teleradiology and ensured continuous and safe radiological services while minimizing risk of virus transmission. And it really underscored the critical role of teleradiology in maintaining healthcare delivery during a global health crisis. Next, I'm going to go into detail about how we use teleradiology. Essentially, radiological images are obtained at the respective originating site, such as a hospital, clinic, or imaging center. These acquired images are then digitalized and securely transmitted over a dedicated network to either a remote radiology site or directly to a radiologist. The receiving radiologist interprets the transmitted images to generate a diagnostic report, which is then sent back to the originating imaging site. And from there, the diagnostic report is forwarded to the ordering healthcare provider for further patient management. Some key applications into how teleradiology is utilized includes, one, remote interpretation and diagnosis. So one of the primary uses of teleradiology is inherent in the name. It's the remote interpretation and diagnosis of medical images. This is particularly beneficial in rural and underserved areas where access to radiological expertise is limited. By transmitting images to radiologists located in urban centers or more specialized facilities, healthcare providers in remote locations can obtain timely and accurate diagnostic interpretations. This not only improves patient outcomes by facilitating prompt treatment, but also reduces the need for patients to travel long distances for radiology services. In the context of emergency and after-hours services, so teleradiology plays a crucial role in emergency settings and after-hour radiology services. Hospitals and clinics often lack the round-the-clock radiologist coverage, especially, nights, weekends, holidays. And the way that this gap can be addressed is through teleradiology, by enabling remote radiologists to provide 24/7 coverage. For example, in emergency departments where you need rapid interpretation of imaging studies, this is vital for diagnosing and managing acute conditions, like strokes, fractures, internal injuries, etc. Teleradiology ensures that these critical interpretations are available ASAP and enhance the responsiveness and efficiency of the emergency care that we're providing. To kind of switch gears, when you talk about subspecialty consults or subspecialty services, teleradiology also facilitates access to subspecialty radiologists. And these are physicians who possess expertise in specific areas such as neuroradiology or pediatric radiology or even musculoskeletal radiology. When there are complex or unusual cases, local radiologists or healthcare providers might have the option to seek second opinions or detailed consultations from these radiological specialists. This demonstrates a collaborative approach, and it not only improves the diagnostic accuracy, but also enriches the overall quality of care by integrating the specialized knowledge and skills into the diagnostic process. When you're thinking about the context of, routine ambulatory or outpatient services, teleradiology is also used widely. In addition to emergency and specialty care, outpatient clinics rely on teleradiology for interpreting routine imaging studies. These can be things like mammograms, chest x-rays, ultrasounds. This application streamlines the workflow and ensures that patients receive timely results and appropriate follow-up care. There is the inherent convenience, right, of remote image interpretation, and that really does yield, optimization of clinic operations and ultimately enhances patient satisfaction. One thing I can think of at the top of my head is reducing wait times for diagnostic reports. That's a huge patient satisfaction indicator for a lot of hospitals. And so there's a huge advantage, right, not only for satisfaction, but for timely reporting and treatment. Within the context of research and education, teleradiology extends beyond clinical applications, and it supports research and education. Academic institutions and research centers can utilize teleradiology to share imaging data. They can collaborate on studies or perform what's called QA, conduct educational programs. Radiology trainees and medical students can benefit then from that access because it really does offer a diverse range of cases and expert interpretations which will ultimately enrich that learning experience. It will allow for multi-center research collaborations, facilitates the collection and analysis of large data sets to just ultimately improve medical knowledge and clinical practice. And I think this is something that often gets overlooked when we are so used to the clinical aspect, because we see the fruits of the teleradiology, but really finding a way to utilize that in research and education is going to improve how we use it, not only the efficiency, but the way in which we use it and how we determine, who has access to this, and, just how we streamline that entire process of use. I do want to touch on the impact of COVID-19 again, because this significantly accelerated the adoption and utilization of teleradiology. As our healthcare systems kind of grappled with this worldwide, there were so many, challenges posed by the pandemic, but teleradiology really emerged as a critical tool for maintaining the radiology services that are so important and minimize the risk of virus transmission. So we try to do that in every aspect of healthcare, but this was one where it was extremely feasible without compromising care or quality. The ability to remotely interpret images allowed radiologists to continue providing those essential diagnostic services without necessarily the need for physical presence, especially in high-risk healthcare settings. And this adaptability ensured continuity of care during the pandemic, which is huge. But it also highlighted the resilience and the importance of teleradiology in responding to things like this global health crisis that we went through in 2020. So in summary, teleradiology has transformed the field of radiology by enabling remote access to radiological expertise, improving emergency and after-hours care, really good with, facilitating subspecialty consultations. It enhances outpatient services, and there's tremendous support to be given, within the context of research and education. To effectively implement teleradiology, a robust and well-integrated infrastructure is essential. This infrastructure includes several key components, each playing a vital role in the seamless operation of teleradiology services. Let's go through each component depicted in this diagram. The process begins with patient registration, and this is where patient information and imaging requests are logged into the system. This step ensures that all necessary patient data is accurately recorded and linked to their imaging studies, facilitating smooth communication and data management throughout the entirety of the teleradiology process. After registration, the patient will undergo the imaging procedure using whatever modality necessary, whether that's X-ray, CT, MRI, ultrasound. Those images that are obtained are digital, and they need to be of high quality to ensure accurate diagnosis. Modern imaging equipment is crucial for capturing detailed images that can be effectively transmitted and interpreted remotely. Once the images are acquired, they are stored and managed in what's called a PACS system. PACS stands for Picture Archiving and Communication System. The PACS is a crucial component that stores, retrieves, and transmits images securely. It acts like a central repository for all imaging studies and ensures that images can be accessed and shared efficiently between the different locations and systems. Those stored images are then transmitted to a remote radiologist or teleradiology service provider. This is done over a secure network to protect patient confidentiality and data integrity. The radiologist will then interpret the images and generate a diagnostic report. This process may involve advanced visualization tools and software to aid in the accurate analysis of images. Finally, the diagnostic report created by the radiologist is sent back to the originating site, and from there, the report is delivered to the ordering healthcare provider, who will use that information to make informed decisions about patient care and management. Having discussed the essential infrastructure required for implementing teleradiology, let's now dive into the numerous advantages that this advanced technology brings to the healthcare landscape. Reduce costs. By leveraging teleradiology, healthcare facilities can significantly cut down on costs. This includes savings from reduced patient travel, optimizes the use of radiology resources, and decreases the need for maintaining a full-time on-site radiology team. It also enables rapid transmission and interpretation of images, leading to a faster diagnostic report turnaround time. This is crucial for timely patient diagnoses and prompt initiation of treatments. One of the most impactful benefits of teleradiology is its ability to overcome geographical barriers. It ensures that patients in rural and underserved regions have access to expert radiological interpretations, making specialists and their care more inclusive and accessible. Integrating teleradiology into healthcare systems really does boost overall efficiency because it allows for streamlined management of radiology workflows. It optimizes resources and improves patient care delivery. As I already mentioned, it extends the reach of radiological services to remote and underserved areas, which ensures that all patients have access to high-quality diagnostic imaging and expert analysis, irrespective of their location. From a healthcare provider perspective, teleradiology provides radiologists with flexibility to work remotely, access and interpret images from various locations. This contributes to better work-life balance and enhances job satisfaction among radiology teams. The same can be said about increased productivity. The ability to, efficiently and flexibly interpret these studies will translate into increased productivity within radiology departments. They're able to handle more cases in less time, which will enhance overall service delivery. So there are significant advantages, including reduced costs, faster turnaround times, elimination of geographical barriers, increased efficiency and access to underserved areas, and greater provider flexibility and productivity. These benefits collectively enhance the quality and accessibility of radiological services, which ensures better healthcare outcomes for patients everywhere. To understand teleradiology from the most balanced perspective, we can appreciate the advantages, but also consider the potential disadvantages of this technology. Number one, risk for miscommunication. Teleradiology involves transmitting radiological images and reports electronically, which could increase the risk for miscommunication when compared to face-to-face interactions. Without direct interaction between radiologists and referring physicians, there may be greater likelihood of misunderstandings or misinterpretations of clinical information, potentially negatively impacting patient care. Teleradiology relies heavily on digital communication channels for transmitting images and reports, which may be susceptible to technical issues or delays. If there are disruptions, let's say in the internet connectivity or system failures, that could lead to delays in communication, affecting the timeliness of patient diagnosis and treatment. Teleradiology is inherently reliant on IT infrastructure for image transmission, storage, and interpretation. This dependence introduces significant vulnerabilities such as system downtime, cybersecurity threats, or even data breaches, which could compromise patient confidentiality and disrupt service delivery. While teleradiology does offer benefits like remote access to specialized expertise and faster turnaround times, we cannot overlook that there are associated costs with implementing and maintaining necessary technology infrastructures to support the success of teleradiology. Initial investments in hardware, software, network infrastructure, as well as the ongoing expenses for IT support and upgrades can contribute to the overall cost of teleradiology services. And to kind of go back to an earlier sentiment, the remote nature of teleradiology may lead to this perceived lack of personal connection between radiologists and patients or the referring providers. Without that face-to-face interaction taking place, there could be some challenges in building rapport, addressing concerns, even providing context for imaging findings, potentially impacting patients and their satisfaction. And lastly, teleradiology has contributed to the commoditization of radiology services by enabling remote interpretation and outsourcing of imaging studies. This can actually result in increased competition based on price rather than quality, potentially undermining the value of radiologist expertise and professional standards. By addressing the disadvantages, we can really ensure that we carefully consider the workflow processes, technology infrastructure, how we communicate, and the quality assurance measures that we can use and maintain to ensure effective and ethical delivery of teleradiology services while minimizing associated risks.